Good morning, Chicago, or good afternoon. It's noon today on Thursday, March 31st, 2022. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we are here to take your COVID questions live, as always. You can use the hashtag AskDrArwady on either Facebook or Twitter, or just put your questions directly into the box below. As always, let's start with our dashboard, chi.gov/COVID-. For the moment, we continue to update this Monday through Friday. There are some states and jurisdictions that are moving to weekly reporting, but for the moment, we're keeping a close eye on things and publicly sharing data still daily. And overall, what we're seeing is, again, just like last week, a little bit of an increase. We're averaging 235 cases per day, which you can see is up from 172 a week ago, but not the dramatic increase, like we've seen in prior surges. And our hospitalizations, we're averaging 11 Chicagoans being newly hospitalized with COVID each day. That is up a teeny bit from 10 to 11, really relatively stable and at quite a low point. Our deaths are actually the lowest they have ever been since March of 2020. If you look here, we're averaging, 0.14 a day is just about one to two COVID deaths a week of Chicago residents. And even last summer, we never quite got down that low. So that is certainly good to see. Obviously, hospitalizations and deaths do lag, and so this is still coming off that surge from the initial Omicron surge. But still, it's really good to see, and most of that is because of vaccination. We're doing about 1,250 vaccinations a day, lower than we have been, but still ticking up every day. We're doing about 20,000 tests every day across the city, and those are the formally reported in a laboratory tests. And then our positivity in that setting is 1.4%. Again, up a bit, still under the 2%, and I'm very happy as long as it's under 2%. That's considered fully controlled. Really, WHO recommends being under 5%. But given how much testing we're doing, I like to see it under 2%. So both of these suggesting some increase, certainly, and that is in the context of BA2 right on time, becoming the predominant variant. We predicted it would be by the end of the month. So let's take a look at some additional data here. So first of all, around the world, the picture is not as rosy as those of you who are following this closely know. Much of Europe, much of Asia, Australia having very, very big COVID outbreaks right now. And we have seen more than 5 billion people now vaccinated. 2/3 of the world's population has had a first dose, which is good. And more than 11.2 billion vaccine doses administered. In the U.S., the news looks quite good almost everywhere. This is the average cases per 100,000 population. You see a few areas in the darker orange and purple here where we are still seeing pretty high case rates per 100,000. So let's talk about how we're looking in Chicago versus other parts of the U.S. So this is off the New York Times. It's an easy place to take a quick look, and I've really liked a lot of the data work that they've made available. But no matter which source you look at, you can see things similarly. These are the states that are seeing the highest rates right now, and you can see that even Alaska, Vermont, Kentucky, the places that are highest, they are just seeing these slight upticks at this point. Nothing, as the headline says, nothing to be too alarmed about at this point, though certainly we're keeping a close eye on it. You can see in our weekly roundup, we are doing a weekly roundup every Tuesday, and as of that day, and putting this out on social, so just so folks know where that is coming from, we'll be doing sort of a summary, and then here's our 7-day average. How did that compare from the prior week and positivity? In our old version of the community transmission and risk matrix, when we're over 200, that brings us, our cases back out of the lower into substantial. But again, we're really predominantly transitioning as of April 1st, officially more to the CDC metrics. But I wanted to show this so you see where we are. The severe outcomes continue to look good. Our hospital beds, just 109 people with COVID in hospital beds across all Chicago hospitals, and that is dropping and getting almost down to that low transmission, less than 100. And the ICU at 25 across the whole city, also getting very low. And if you look at our diving in a little bit closer off our dashboard, you can see that little uptick in our COVID cases. It's quite similar to what other cities are seeing. You look at New York City there, for instance, they're averaging about 1,235 per day. They're 3 times our size or more. And you can see, just like what we're seeing here, sort of down and then just seeing some increase. And that seems to be consistent across the country. As far as COVID-19 community levels, Chicago remains in low, limited impact on our healthcare system, low levels of severe illness. And our travel advisory, we are using these CDC community levels, just under 9%. 286 of the more than 3,200 counties in the U.S. and Puerto Rico had COVID levels that were not low, that were medium to high. And we do advise anybody traveling to take a look at that map and then precautions. And so here is that map. You get a sense, all of Illinois is green right now. Really, just about all the Midwest is green right now. But there's an area up in northern Michigan that's having a bit of a surge. You can see eastern Montana, parts of Kentucky, a little bit of Texas. And if people are traveling to those areas, that's where, in a medium risk area, we recommend thinking about, for example, putting on a mask in public settings. And in an orange area, you should wear a mask in indoor settings. If you're not vaccinated, you shouldn't travel to orange counties, and that is where we are on the travel advisory. Here's what's happening with variants. So, reminder, there is Omicron B1, which was the original Omicron, and then there's Omicron BA2 that we've been watching for about 6 weeks. And just as projected, we were estimating that approximately the end of the month, we would see the majority, meaning more than 50% of our cases here in Chicago and in the Midwest, being that Omicron BA2. And in fact, that's exactly where we are, 50.4%. And so that means that we're watching especially closely now, because historically when we have seen a variant or a subvariant move to predominance, meaning that it is more than 50%, that sometimes has signaled additional surge. That said, BA2 is not the same as the other variants that we've seen. Omicron, the original Omicron B1 and this subvariant Omicron BA2 are really pretty close to each other genetically, and the protection is good for people who had Omicron B1. In various studies, real world studies around the world, people who were recently infected with the original strain of Omicron seem to have more than a 90% protection against Omicron BA2. So that's different than, Delta to Omicron. We saw a lot of people getting reinfection there, and we're not expecting too much reinfection with BA2. Certainly continue to be concerned about people who may not be up to date with vaccination, but overall, this is what we're watching. However, one other interesting thing is actually here in Chicago and in the Midwest, we are behind the East Coast in terms of seeing BA2 really take over. Across the whole country, 55% of Omicron is now BA2, and remember, we're at 50% here. But if you look up in the northeastern U.S., that light pink is the Omicron. And, in New York that I was just showing you, they're seeing more like 70, 75% already being that BA2. And so I feel relatively reassured by the fact that even as we've seen BA2 be replacing B1, we've not seen major surges, even though we are seeing some increases. So all of that, keeping a close eye on it, but continuing to look quite good. Just as a reminder, starting tomorrow, our vaccine incentives are shifting. So up through today, anybody who was getting vaccinated through our Protect Chicago at Home program, through CPS clinics, through our various pop-up clinics, et cetera, we were offering $50 gift card incentives just for the first and the second doses, not for boosters. But starting tomorrow, April 1st, that vaccination incentive program is only going to be focused on our zip codes. We're still less than 70% of our residents are fully vaccinated. And so that's the list of the zip codes on the left and the map on the right. So you can see it's most of the zip codes on particularly the far south side as well as the west side. And anybody who lives in those zip codes remains eligible for the gift cards for first and second doses. Where there are school events, where there are other events that are focused in those areas, will continue. But otherwise, we are ending that incentive program for the rest of the city. And that's partly to make sure that we have funding available to continue to ensure that no matter whether somebody is insured or not, that we can offer all vaccination completely free, which we absolutely intend to do across the city indefinitely. Our very popular Protect Chicago at Home program, also as of tomorrow, is going to a 4-day-a-week schedule. And we'll be operating Saturday through Tuesday, 8 a.m. to 6:30 p.m. We had been operating 7 days a week. Actually, we started at 5, and then weekends were very popular. So we're keeping the weekends. And, if we got to a point where this was full and we needed to add days, we would do that again. But right now, with the demand that we're seeing, 4 days a week should cover that. So just as a reminder, anyone over 5 can get a vaccine at home, regardless of insurance, immigration status, age, et cetera. We've got Pfizer, pediatric, adult, and booster doses. We'll vaccinate up to 10 people at the same time. And to schedule, 312-746-4835, or you can sign up, chicago.gov@home. Already we got a question in, if I'm eligible for a second booster, which we'll talk about, can I get it through the at-home program? The answer is yes. You can sign up for a second booster through the at-home program, but also those second boosters are widely available at pharmacies, including without appointments, at our pop-up clinics, at our CDPH clinics, at our partner clinics, and of course at most medical care providers' offices across the city. Our call center staff have also been reaching out and calling people who got some vaccination with the city but had either not had their second dose or are higher risk and had not had their first booster. And we've actually made more than 100 appointments. So if you get a call from us, please reach out. So let's talk boosters for a second. So as a reminder, that first booster, when should I get my COVID-19 booster? The same one we've been talking about forever, applies to anybody over the age of 12. And we do recommend that anyone over the age of 12 should get boosted, meaning a third shot, or if you started with J&J, a second shot, 5 months after your initial Pfizer or Moderna series, or 2 months after J&J. So if you have not had that third dose, that remains strongly recommended, and we encourage anyone over the age of 12, when it's been that long since your first vaccines, to get that booster. But what about the second booster dose? And we got a lot of questions here, so I put the official information and we'll talk about it. So just earlier this week, the FDA and the CDC gave a green light for the second booster dose for either Pfizer or Moderna vaccines. And it showed that, we'll talk in detail in a minute, but it improved some protection against severe COVID, didn't see any new safety concerns. And specifically, this is for anybody over the age of 12 who is moderately or severely immunocompromised. And there's always been some slightly different recommendations for that group. So this is not, this is, you see a doctor for your immunocompromised, that is a recommendation for an additional dose. But the big one was for anybody 50 and older. So if you're over 50, you are eligible for a second booster dose. And we'll talk in a minute about kind of our recommendations about it and how to think about that. And then they just doubled down on the fact that if all of the vaccines that you've gotten to date have been J&J, if you got J&J for both your first dose and then you also got J&J again as a booster dose, they are recommending a booster dose for that group. But we don't have very many people in Chicago like that. So it's more for the adults 50 or older that we'll be talking about. I also wanted to bring, we'd gotten some questions about menstrual irregularities last week, and so there's a link here to, you can look up nih.gov if you want to see some of the big studies that have been done. But there was a large study of this that appeared in Obstetrics and Gynecology recently, and it found that women who got a dose of vaccine during a menstrual cycle had an increase in their cycle length of about 1 day compared to unvaccinated women. And that increase in cycle length, meaning a longer time between bleeding, was not associated with a change in the number of days of bleeding. So you saw a slightly longer time in between periods. That's what that means. No impact on fertility, no impact on no long-term change seen, but that seems to be what they found, less than 1 day of lengthening. So you can take a look at that if you're interested. And just as a reminder, if you catch COVID, regardless of your vaccination status, you need to stay home for 5 days. If your symptoms are resolving or gone by day 5, you can leave your house, but you have to continue to mask while around others for days 6 through 10. And that's regardless of vaccine requirements, at the city level. So even right now, when masks are not required everywhere, if you're in days 6 through 10 of just recovering from COVID, you need to have that mask on in public spaces. If you haven't ordered yet, get your second round of free at-home COVID-19 tests, covidtest.gov. You put in your information, no insurance, they don't need anything else about you, and they're coming in days. So please order yours now if you haven't. Treatments are available. There are IV and oral medications, but they need to be taken in the first few days of infection. If you're over 65 or have underlying conditions and test positive, call your healthcare provider. That is what we want you to do. This isn't something, it's not available everywhere, but your healthcare provider knows how to get you hooked up to a pharmacy that has it. All of our federally qualified health centers are able to get people connected. The federal government has been ramping up more availability, but you should not go out and just try to find it, because you cannot get it without having a prescription for it, without having seen a medical provider who looks at the other medications you're taking, looks at your history, and makes a recommendation of whether or not you should receive those early treatments. I also wanted to highlight covid.gov, a new one-stop shop it's a federal shop, but you can look it up at the county level. You can see county level guidance. You can see where there are free masks, vaccines, treatment, testing available. So check that out. And I wanted to highlight some of the work that's going on our far south. Our Healthy Chicago Equity Zone partner, Phalanx Family Services, is doing a campaign particularly focused on African American younger men, age 18 to 45, who have Chicago's lowest vaccination rates. And so they are actually encouraging people to become Vax influencers and get paid. You get a $50 per person referral bonus. I know there was some private funding to help support some of this. It's in collaboration with Northwestern University, Chicagoland SEAL program, and this is, partners really wanting to work on protecting an important part of communities and families, black men. So I would encourage you to check that out if you're interested, and thank you. Very pleased to see all the creative ways that we continue to really work on getting folks vaccinated, especially when rates are low. It's a good time to get folks caught up and work on some of those inequities. I also just wanted to remind you that this week there are 4 more town halls coming up. If you're interested in learning about community safety efforts in your region, policing work, but more than that, a lot of the more public health preventive interventions that are happening. And so this Saturday, there's a youth-focused one at Harold Washington Library, 10 to 12, and then one focused on City Center, 2 to 4 at Harold Washington Library. Monday evening, we're doing the Southwest side at Daly College. Tuesday, we're doing the North and Northwest side at Truman College. And I've been to both of the first two, really enjoyed the conversations. So come out. We're looking for input and ideas, and it's an important issue, and we're trying to address, in the same way that COVID has been an all-city response, we are trying to think about community safety as an all-city response. So hope to see some of you there. And then finally, we've gotten some questions about provider reimbursement programs, where the federal government is no longer reimbursing providers for some of the COVID care for people who are uninsured. And I just wanted to be really, really clear that no resident in Chicago should be turned away from receiving a COVID-19 vaccine. No resident should be asked to pay for a COVID-19 vaccine. We have agreements with providers about that, et cetera. And we are, as always, we are committed to making sure anyone can access COVID-19 vaccine, regardless of insurance, level of income, or immigration status. So if you need a vaccine or a booster, you have questions, chai.gov/COVIDvax or our call center, 312-746-4835. And let's get into your questions. Okay, so some questions right off the bat about boosters, which is the main thing I've been answering questions about. So first of all, let's take a quick one. Elena Levy from Facebook. Can you get the fourth boost, the second booster at home? You can. 312-746-4835. As long as you're eligible, meaning you are over 50 or you are over 12 with the moderate or severe immunocompromising condition, we're happy to do that. Bob Fisher from Facebook. What can you tell us about folks who are nearing 50, wondering about a fourth booster? I got my initial booster in October. I have diabetes under control most days. So, Bob, I'll come back to your situation in a second, but let me talk a little bit more. I'm seeing a lot of questions here about boosters. Elise Block, Jeff Shaw, etc. So why don't we talk about boosters, and then we'll, whatever we don't get to, I'll hit some of your details. So some people are asking, why a fourth booster now? Do I need to get a fourth booster? It seems like the recommendation isn't quite as strong as what we saw previously. So let me give you my take on this. We clearly saw that the first booster, meaning the third dose for most people, saved lives during the Omicron surge. People who were boosted were 21 times less likely to die of Omicron than people who had not been vaccinated or boosted. And the biggest improvement in protection against hospitalization and death was people who had gotten their first and second doses. No doubt about it, that remains the most important. Anybody out there who still has not had their first or second doses of COVID vaccine, please, now is the time, because as the virus continues to mutate and we get new variants and we're seeing these move so much more quickly, et cetera, it is really not a time to not have that protection. So first and second are most important. We saw during Omicron that having that booster helped additionally. It helped keep people out of the hospital, it helped keep people from dying, and it helped keep people from getting infected. We saw a lot more breakthrough infections with Omicron. I heard Dr. Fauci say the other day, the version Omicron is definitely a 3-vaccine kind of variant, meaning that really we needed folks to have had all 3 of those initial doses to have, the best potential protection there. What happened earlier this week is that the FDA and CDC gave the green light to a second booster, but they didn't make the recommendation quite as broad or quite as strong as what we've seen previously. And I think there's a few reasons for that. Number one is that we are still working on collecting the efficacy data, meaning how well that fourth dose is working in the real world. And part of the challenge is that the world right now is in such different states of vaccine risk, and we've seen different countries take some different approaches to boosters. So if you think back last fall, there was actually some controversy about whether we should be doing a booster. A lot of the world had not yet even been able to access first and second booster doses. At this point, there still is a long way to go in terms of global vaccine equity, but we have a lot of vaccine available that is already distributed in the US that can't be made available internationally. And I do think, frankly, that there's a good chance that we're heading toward potentially this fall. I wouldn't be surprised if we actually have a booster recommendation for everybody in advance of, how we think of flu shots ahead of flu season. But that is more likely to potentially be a newer version of a vaccine that has been made more specifically for the ways that the virus has changed. If you think about it, the versions of the vaccine that we're giving now are still the original versions. And it's been amazing to see how good the protection is, especially against severe illness. But with each subsequent wave, we're seeing less protection against infection. And so the booster definitely brings your antibody levels back up to where they were after the third dose. And what we see is after 3, 4, 5 months, you start to see some waning of the antibody levels in your blood. Omicron moved so quickly, it was so contagious that part of the reason we saw a lot of breakthrough was that if people didn't have high levels of antibodies in their blood, they would get infected, but their B cells, some of the other parts of their immune system, if they were previously vaccinated, were able to kick in and keep them from getting seriously ill. So the vaccine, for many people, was doing its most important job, but the booster clearly made a difference. They made the recommendation for that third dose based on data primarily out of Israel, because in Israel, they had started doing a third booster dose, clearly seen a benefit of that additional booster. Where we are now is, again, looking at Israel, because Israel has offered fourth doses of Pfizer vaccine to its older population. And in a big study of tens of thousands of people, there was a slightly lower risk of death from COVID in people who had a fourth dose as opposed to just having a third dose. There was no safety concerns. There does not seem to be any downside of getting a booster on an individual level, meaning that it doesn't somehow make your immune system less responsive. Like there's no downside to it. But the additional amount of protection was not as great, like in terms of how much more you got. First gives you the most, second, you need first and second together. Third gives you another really significant boost of protection. Fourth gives you some boost of protection, but probably not as much as first, second, or third did. So for everybody who's trying to decide what should I do about boosters right now, I would say, first of all, the most important thing is not just you, but everybody around you. Have they all had their first, second, and ideally third booster doses of COVID vaccine? For somebody who is over 65, I think it makes sense to get that second booster. We know people over 65 have all along had the highest risk of hospitalization or death. Your risk right now in Chicago is low, but I think part of the discussion here is that if we were to see a really significant surge, in this next month or two, it's too late to really start vaccinating the population at the time of a major surge. You can put masks on. Masks start to work right away in terms of some of that additional protection. But vaccination, it takes a couple of weeks to kick in. It's a big operation. And so for people who are the most vulnerable, meaning those over 65, and then I would say those over 50 with an underlying condition, I would probably recommend getting a fourth dose. But knowing that you should, you can talk to your doctor if you have questions about it. The more important thing is that the people who you're interacting with are up to date, meaning third dose in your network. And I think for the people who are asking around, for example, I'm nearing 50, my diabetes is generally under pretty good control. I got my initial booster in October. So I would say, your risk is low right now. And I would, until, talk to your doctor always is going to be my answer on an individual level. But if you're under 50, even with diabetes that's relatively well controlled, right now the recommendation is that you do not need a fourth booster. And I think, when you turn 50, it may be something that you want to do. And if you're talking to your doctor makes another recommendation. But you're not considered moderately or severely immunocompromised just from having diabetes. And again, risk overall is low. You've done the most important thing, which is getting your first, second, and third booster. That's my high level conversation. I always refer people for more conversations to the doctor. Jeff Shaw is asking, what are my thoughts about mixing or not mixing vaccines if getting a second booster? If I had 3 shots, is it best to stick with Pfizer or stick to Moderna? So there has not been good, strong scientific evidence one way or the other with that. I will say that the mRNA vaccines, meaning the Pfizer or Moderna, do seem to have better protection than the J&J, which is why at each point you've seen some slightly different recommendations for folks who started with the Johnson & Johnson vaccine. I am not over 50. If I were and had an underlying condition, I've had Pfizer, all 3 so far, I would probably just get another Pfizer. I don't think there's a major difference between them. And importantly, CDC has not actually recommended one or the other. We know, depending on availability, it may be easier for somebody to get a Pfizer or get a Moderna. I think, especially for a fourth dose, probably the additional benefit you're getting is relatively small, and we see the antibody levels come back up nicely with both of those vaccines. So personally, I would probably stick to, this is my personal opinion, the one that I started with, which is Pfizer. I've not had side effects with that. I've not had issues with that. But I think, if you made a decision, I don't think you can really, we certainly don't have evidence that suggests switching, especially when you're at this level of a booster, has any significantly different difference on your immune response. I do think if and when we end up needing a vaccine down the line that is reconfigured for some of the more infectious variants, obviously then the type of vaccine may be more important. But in the absence of any data clearly suggesting that one type of booster is better than another, I think either a Pfizer or Moderna is a perfectly good choice. And I saw Elise had a similar question. And Elena Levy has this question, wondering about how Pfizer and Moderna antibodies, do they stack up equally? I'm hearing people say it's good to mix it. Is it true? We do not have clear evidence that one or the other is better. You heard me say, me personally, I would probably stick with the one I've had just because it's the one I've had. If we have evidence at some point that very clearly there's a difference, especially in terms of mixing and matching, we'll let you know. One of the things you're reading, or you may be reading, Moderna and Pfizer, actually the Moderna booster is a lower dose than the original Moderna vaccine. So whereas Pfizer is the same dose of vaccine for first dose, second dose, and third dose, Moderna actually had a higher dose for its first and second dose, and then has a slightly lower one for its third dose. And this is just as they've been able to, again, look at the data, what's needed in terms of efficacy versus side effects. But overall, I think you can do either, and I would encourage, like I said, I'm sticking with the one I had all along, but if I had started with Moderna, I probably would stick with Moderna. Like that's just me, but you can make your own choice there. Alicia on Facebook, with so much at-home testing going on and continuing to increase, is the health department confident it can monitor virus trends without the lab-confirmed data? Yeah, that's such a good question, Alicia. We are, and that's because all along, case count is only one piece of what we monitor. And so I'll tell you, I'm very reassured. For example, our emergency department COVID diagnoses are something we've been tracking since the very, very beginning. They have typically been the first sign of major increases. And people who go to the emergency department and then test positive, for COVID at the emergency department, they may be going because they don't have testing access. More often, they're going because they have notable symptoms and they're needing to get seen by a provider. They may or may not have access to healthcare. There are different things about folks who go to the emergency department, but it is a particular segment of data. And all along, we've seen rises in that early. Sometimes, even when we're seeing even before specific rises in cases, and that data looks good. We also obviously, since the very beginning, anybody who's got potential COVID symptoms is getting tested in a hospital setting or potential death. So we watch those numbers. Our wastewater data also, although it is still sort of in its infancy or toddlerhood, we watch that for signs of new variants or signs of significant concern. And then the other thing is that, remember, cases and positivity go together. Positivity, positive cases is just, there's 237 or whatever positive cases out of 20,000 something tests that are being done a day. If we were to see positivity get up to 10%, 20%, 30%, you're not testing enough and you're missing a whole lot of extra people. When you have a positivity as low as we're seeing in Chicago, I know that there are not a huge amount of kind of missed tests, and we're able to separate out the tests that are being done for screening, particularly in schools. And in schools, we also look to see what percentage of, those are kids and staff who we do not expect to find COVID in, different than the people who go to get tested because they have symptoms. And there too, our numbers, our positivity across tens of thousands of tests has been absolutely beautiful. Less than 0.5%, well less than 0.5%, and no signs of major changes there. So that's just an example of the different systems that we look at. And we are not done with COVID. If you are hearing people say COVID is over, I wish COVID is over. It is not. But we continue to be in a relatively low risk spot here in Chicago, and we're watching closely for signs of significant concern. And to that point, Namratra Batra on Facebook is saying, now that there's a substantial increase, is it time to bring the mask back in CPS? No. So again, in CPS, but not just in CPS, in public settings broadly, really we're using the CDC metrics. We're showing, it's the last day of March, and we committed to sort of through the end of March, continuing to show those previous metrics that we're showing. And we're continuing to follow them. We'll have them available on the website, et cetera. But in terms of really thinking about risk, partly to the prior questioner's point, case counts mean different things, where your testing patterns have changed so much, where you are testing, tens of thousands of asymptomatic people in screening programs. And so we are using those CDC metrics. If we get to yellow, for example, not green, but yellow, that would be a setting where we would have a higher concern. We'd be making recommendations potentially for indoor masks, and then I would expect that settings like CPS would choose to put them in. CPS is doing beautifully, as are our private and parochial schools. Are we seeing some cases? We are. Are we seeing occasional clusters? We are. Are we seeing any sign that taking the masks off has led to any kind of widespread increased risk of infection? No. And we've been watching closely for that. Okay, so I have someone named Faded on Twitter who says, "Hi there, city health misinformationer." I think you're trying to make a joke about that. If you have any misinformation that you think I have shared, I would love to see what that is, but I'll take your question anyway. It says, BA2 is dominant in the US, and Chicago has seen high spikes of COVID-19 in wastewater testing. Not sure where you got that information. Considering BA2's competitive advantage over BA1, why is there no mask mandate again? Okay. So BA2 is dominant, not just in the US and Chicago, like we were just sharing. We're at just over 50% here in Chicago. The US is at about 55%. The Northeast is at about 75%. And we are watching that very closely. But even in the Northeast, even where it's the huge majority, are we seeing some increases? We are. Are we seeing anything that is of major concern? Not yet. Do I know for sure we won't? No. But masks, remember, start working right away from when you put them on. So if we see major signs of concern, of course, we would reinstitute masks, but there's not a need. And Chicago has definitely not seen, quote, some of the highest spikes of COVID-19 in wastewater testing. If you go to the website and you read the most recent report, we've been putting out monthly reports. I had one of the doctors who leads our lab-based surveillance and wastewater testing on about 2 weeks ago, sort of explaining what wastewater looks like here. Did we successfully detect increases in COVID-19 during the Omicron surge? We did. Did those come back down? They did. And they're at very low levels. So you'll continue to see some fluctuation there, but there is nothing that we are seeing of major concern. And that is true actually across the US. When I'm on these national calls, people are sharing out what they're seeing, and everybody's a little concerned because we would be wrong not to be concerned based on what we're seeing in a lot of the rest of the world. But the good news is we waited here to lift requirements until we were all the way back down to having low risk levels by every single measure. And when you wait, you have a lot less COVID that can continue to spread. So, there are more cases here than there were a couple of weeks ago, not unexpected. And we probably will continue to see some increase. I wouldn't be surprised about that at all while BA2 continues to take predominance. But the fact that we're currently seeing such low rates of hospitalization and literally the lowest rates of death we've ever seen, and no signs of major concerns in the other surveillance data tells me to be a little bit concerned, but certainly not at a level that we need to be making city-level recommendations around mask mandates. Similarly, or not similarly, but opposing, Liz from Twitter says, after 2 years of data, we know that masks and vaccines do nothing to affect the pandemic trajectory. Why would we consider putting these back into place? It's now about feeling safe versus actual facts. So I want to be clear that there actually is data that both masking and vaccination notably impacts the pandemic trajectory. So there have been studies within schools, there have been studies within states, there have been studies across countries. So we are not considering, I don't know where folks, it's always interesting to me sort of what folks hear. Right now, we are at a low risk state. We are not putting right now mask requirements back in place. We are not putting vaccine requirements back in place. However, if we start to see a significant surge, we start getting into that yellow risk, per CDC at the county level, we would think about recommending, and then if it gets worse, requiring some of those same measures. Take a look at Hong Kong if you want to see how important vaccination is. Hong Kong does not have a very high vaccination rate, especially among its older residents. And Hong Kong is getting this Omicron surge right now and seeing the highest death rates it has ever had. I mean, to the point, I was listening to a story the other day where they are, if you think back to the beginning of COVID for us, where morgues were getting overrun, et cetera, that is actually what has been happening in Hong Kong. And you compare that to settings that have very high vaccination rates, and they are tolerating, the difference when you see that map I showed you at the beginning, where you're seeing the dark purple around the world and these very high case rates. Most of those settings are quite a bit more vaccinated than the US. And so despite seeing ridiculously high case rates in some of these countries, because they're more vaccinated, they're not seeing surges in hospitalization or death, at a level that threatens the healthcare system. So the vaccines are definitely making a huge difference. I can't imagine what this would have, if COVID had shown up like Omicron at the beginning. It's really scary to think how much worse this would have been. Elena Levy from Facebook says, I heard that the test to treat pharmacies are not lined up as announced. What's going on with that? So a couple things are going on with that. So first of all, the test to treat, that is a federal program, and they are working to make sure that there are pharmacies that have the test to treat option available. And there are certain pharmacies from CVS, like CVS and Walgreens here, that have designated pharmacy locations to have treatment available, but also to have the minute clinic type where you can be seen. That's a federal program, though the sites that are listed are the sites that the pharmacies have chosen as the sites to implement that program. I clearly, I'm understanding that people are having some challenges accessing some of that. COVID.gov, again, if you want to look and see sort of all the federal resources. Separate from that, CDPH specifically has been working to make sure that providers know how and where to send patients, both for infusions and for or the oral treatments. We've been working to make sure federally qualified health centers in particular can access and know, again, how to connect patients. And you cannot show up at a pharmacy just looking to buy these medications. Again, you need to see a healthcare provider. So it's not just does CVS or Walgreens have the medication, although actually you can look that up. Like there's doctors can look and see, okay, this pharmacy location at here literally has 20 doses of Paxlovid. Like that data is available nationally in terms of where they can refer patients, but that doesn't mean that you can show up at a pharmacy and just get it. You need to see a provider, meaning if you're going to see a provider in a pharmacy, it needs to be the pharmacy's provider. So once again, if you are diagnosed with COVID and you're high risk, over 65, underlying conditions, concerned, please call your healthcare provider. Go in, have an urgent care visit, get seen, right away. Don't wait a week and a half because it's too late to access the early medications at that point. And right now, if you don't have a doctor, now is a fantastic time when things are relatively calm to get yourself a primary care doctor. If you're insured, look on the back of your insurance card, call that number, go to that website, they'll get you set up. If you're not insured, there's a federally qualified health center near you. We're lucky to have a lot of them all over Chicago. Chicago. They take people, they get extra funding specifically to see people who may be uninsured. CDPH can help, get folks connected where necessary. But I really, in terms of being prepared right now, a lot of it is about, are you taking care of yourself more broadly? Are you connected to a primary care provider? I want to make sure everybody is. And that should be your first call. Certainly, they're interested in making sure that pharmacies can help fill some of those gaps. Then the federal government has been working, to have more of that available through pharmacies in settings where there may not be as much primary care accessibility. But FQHCs, for me, or the community health centers, are the first stop. All right, so we are at time, or just about. Let me just see if there's anything else. Karen Nathan Sussman is asking, if someone age 65 gets a second booster now, will that preclude their ability to get a fall booster if a new variant-specific or fall booster is recommended? Definitely not. I am quite sure that we'll be doing more of a universal, I wouldn't be surprised, depending where we are with COVID, that we're doing sort of a universal recommendation around the time that we're doing flu shots, and there will, you can never 100% guarantee everything, but I can 99% guarantee that anybody who gets that second booster would not only still be eligible, but almost certainly would be recommended to get potentially a more variant specific or an updated booster in the fall. So that is not a downside, not a reason not to get it. And then also asking, is pregnancy a reason to consider getting a second booster at age 30? I would ask your doctor about that. Certainly we want to make sure pregnant women are completely up to date, and we know that pregnancy can be a higher risk condition. So I would ask your OBGYN, but that is a very good that is a good question. All right, is the fourth dose free? It is. It is free to everybody. You may not be charged for a vaccine, for a COVID-19 vaccine in Chicago. So again, reach out to us if you have issues with that, but it is free. Regardless of your insurance status, and will remain so. Thank you for your attention, and we will be back next Tuesday at 11 a.m. We are planning to probably routinely be doing Facebook Live Tuesdays at 11, just so there's kind of a regular time and cadence for this. We're committed to keeping it once a week, and sometimes there are things going on, but as the default, we'll be really aiming for Tuesdays at 11, and we'll keep taking questions for as long as you're sending them in, and continue to bring in some guests too to highlight some of the ways we're trying to take the lessons from COVID, to our public health work beyond COVID. So thank you very much for your attention. Have a good week. Please be safe, and we'll see you back next Tuesday. Bye-bye.